So after high school, I joined the Navy, and I was active duty, and I had no interest in the medical field. But once I took the ASVAB exam and the recruiter went over the different options I had, I got down the list that was in alphabetical order and got to corpsman, and I asked him what that entailed, and he told me it was similar to Hawkeye from MASH. I love that show, so I signed up to be a corpsman. I spent 5 years active duty, and then when I got out of the military, I started going to undergrad. And luckily enough, my grades were acceptable enough that I just kept pursuing the medical field. Orthopedics was always something that I would have an interest in, with being in athletics and so on. Having the interest only isn't enough. You have to have a certain grade standard to be able to get the option to go into orthopedics or other things. Orthopedics was an easy call for me once I saw that I had a joy for it and the surgeries and so on. After I got into ortho, I realized that I wanted to hone in on the upper extremity. So while at the Mayo Clinic, the last years of my residency, I did a lot of rotations with shoulder and elbow. And then to try and consider myself a complete upper extremity surgeon, then you needed to do a hand fellowship, and so that's what I did. I think that people or patients live with discomfort too long. Many times they're afraid to go to the physician because they're afraid they're going to be told something drastic has to change or they're going to have surgery. I try to treat patients as if they're somebody in my family. So if it's a male who's close to my age, I treat him like he's my brother. If it's a female who is the age of my mother, I try to treat him like my mother. I don't throw surgery out as something easily recommended. I treat them like they're somebody in my family, and I try to give them those options, understanding they have a life, they have a job, they have activities, and they want to get back to those things just like I would. Golfing, I think that's my hobby, my passion. It gives me something else to do and to work on because it's always a work in progress. Ask Tiger Woods. It's something that it's an individual sport. You're not playing against another person, even though you can set it up like that to play against someone else, but you're really playing against yourself and the golf course, and that's a challenge that I like to have. Married, I have 4 kids, so I have a son and 3 daughters. My son loves golfing. My daughters are big into cheerleading. We spend a lot of time together. We're a strong family.